Vitamins, minerals, and amino acids are essential in health. Let's take a look and see their effects. A quick history of the vitamin era began with Casimir Funk, who coined the term vitamins in 1911 from natural foods to protect against beriberi. Joseph Goldberg, Conrad Ilvayam, Albert Szent-Györgyi, Roger Williams, Linus Pauling, and Dorothy Hodgkin were all pioneers in understanding the chemical compositions of nutrients. To understand how vitamins treat deficiencies, we must look at their structure, absorption quality, and the food source from which they are derived. Understanding their therapeutic considerations, and importantly, their safety, can provide individuals and healthcare providers the ability to make decisions for the needs of the individual. Vitamins are classified on whether they are soluble in water or fat. The fat-soluble vitamins are vitamins A, D, E, and K. Water-soluble vitamins are your B and C vitamins. According to today's verbiage and how products are produced, there are other classifications of nutrients. For the individual new to this information, we will keep this simple. Vitamins are organic compounds needed by the body to achieve healthy metabolic function. They are considered essential and cannot be converted into energy alone, but some are needed in energy production. The body generally does not use vitamins as they occur in food. They must be transformed into their coenzyme or cofactor form, the active functional form the vitamin ultimately takes for metabolism. This must happen within a healthy gastrointestinal tract. To understand healthy gut function, refer to our gut health video. The B vitamin family consists of thiamine B1, riboflavin B2, niacin B3, pantothenic acid B5, biotin, pyridoxine, and pyridoxal B6 with different forms of folic acid and B12 known as cobalamin, which there are also different forms. All affect metabolic activity, energy production, and hematopoiesis, meaning the formation of blood cellular components. Vitamin insufficiency resulting from poor nutrition is common in the United States and has many facets. Depending upon the degree of deficiency, disease states may or may not occur for many years. The higher the degree of deficiency, the more symptoms may show as a disease. Poor nutrition concerning B vitamins includes insomnia, irritability, modified appetite, sugar cravings, impaired drug metabolism, and reduced immune competency, to name a few. Unfortunately, allopathic medicine rarely tests for these insufficiencies until disease symptoms are present. Here are some simple classifications of B vitamins by function. Energy metabolism needs thiamine B1, riboflavin B2, niacin B3, pantothenic acid B5, biotin, and pyridoxine B6. Hematopoiesis, meaning blood cell production, needs folic acid, cobalamin B12, pyridoxine B6, and pantothenic acid B5. Other metabolic functions need thiamine B1, riboflavin B2, niacin B3, pyridoxine B6, cobalamin B12, biotin, and folic acid. You can see where the B vitamin needs for different actions overlap. RDA, or Recommended Dietary Allowance, prepared by the Food and Nutrition Board, which reports to the National Research Council of the National Academy of Sciences, defines the nutrient level required to prevent deficiencies. The RDAs presently do not reflect optimal intake for an individual, mainly when many consumers are on the SAD, which is the standard American diet. 1990, the National Food Labeling Education Act, NLEA, established the Reference Daily Intake, RDI, for vitamins and minerals. The RDI refers to the level of a nutrient that meets the needs of all healthy people, calculated by age, gender, pregnancy, and lactation categories. The Daily Reference Value, DRV, is a consumer guideline that provides a basis for comparing specific food components such as total fat, cholesterol, dietary fiber, and sodium. A qualified healthcare provider should evaluate each individual to see their shortcomings and properly assess their needs. Whatever one thinks about the value of RDAs, RDIs, and DRVs, these are provisional standards for preventing overt nutritional diseases. These gauges do not consider environmental exposure, prescription drug intake, digestive and absorptive capabilities stated in our gut health video, genetic differences known as polymorphism, food intolerance, and one's dietary intake, biochemical individuality and stress affecting central nervous system deviations must be considered when evaluating supplement needs. So let's break down each vitamin's role in physiologic functioning. Let's remember that the vitamins, as written here, are for understanding their roles in the body, but depend upon many factors for absorption and usage. Some terms you will see are coenzyme, cofactor, intracellular, xenobiotic, cell differentiation, and enzyme. Don't worry, these will be explained. Coenzymes are organic compounds required by many enzymes for catalytic activity. They are often vitamins or derivatives of vitamins. A cofactor in biochemistry is a substance, other than the substrate, whose presence is essential for the activity of an enzyme. An enzyme is a substance produced by a living organism that acts as a catalyst for a specific biochemical reaction. You can see how all of these work together. Let's go through each vitamin so we have a basic understanding of their role in health. Vitamin B1. Thiamine acts as a coenzyme in many reactions, acting in the small intestine. Thiamine is central to energy production and central nervous system function, including neuronal and neurocognitive function. Thiamine helps with phagocytic, immune cell, activity during inflammation. Under conditions of increased energy need, higher thiamine requirements may be needed. B1 is also needed to synthesize acetylcholine, ACH, a neurotransmitter that plays a role in memory, learning, attention, arousal, and involuntary muscle movement. Foods that contain the highest amounts of thiamine are found in brewer's yeast, wheat germ, peanuts, sunflower seeds, pork, pine nuts, and soybeans. Diets high in certain fats and sugar and excessive cooking may deplete thiamine. Alcohol consumption can lead to more severe B1 deficiency. Vitamin B2, riboflavin, has two coenzyme derivatives that make up riboflavin. Absorption occurs in the upper intestine. Both adenosine triphosphate ATP and sodium are needed for absorption. Alcohol, antacids, and psyllium gum are used as a fiber for slow absorption. Riboflavin is best utilized with food and when bile salts are present. Some elements such as copper, zinc, caffeine, saccharin, vitamins B, 3, C, and tryptophan reduce bioavailability. They are easily remedied by supplementing B2 in the diet. Riboflavin B2 plays a role in the enzymes that catalyze oxidative reduction, which relates to detoxification processes that occur from metabolic activity. Riboflavin affects detoxification via certain enzymes to support drug metabolism called xenobiotic metabolism, lipid, or fat metabolism. It provides antioxidant protection because of its role as a cofactor in the regeneration of glutathione. It also involves folic acid, pyridoxine, vitamin K, and niacin metabolism. Foods that contain the highest amounts of riboflavin are organ meats, torula yeast, brewer yeast, almonds, wheat germ, and some mushrooms. Foods that contain riboflavin, such as milk if sold in glass bottles light, will reduce the amount. Chronic alcohol or other drug use, as well as decreased thyroid or adrenal activity, may reflect lower riboflavin levels. Individuals with fatigue, muscle weakness, and signs of oxidative stress, which will be covered in later video levels, may indicate to a healthcare provider low vitamin B2. It's important to mention that many skin conditions, visual disturbances, cataracts, diabetes, and arthritis correlate with low B2 levels. Vitamin B3 niacin or nicotinic acid and its nicotinamide derivative are known as nicain or vitamin B3. The conversion of extracellular nicotinamide into NAD seems to be under hepatic, meaning liver control, and the liver will store excess nicotinamide as NAD. Nicotinamide can be reconverted into NAD in most tissues by healthy microflora in the intestine. Tryptophan is a precursor to niacin. Niacin forms the active enzyme nicotine adenine dinucleotide or NAD, which is involved in critical cellular processes involving oxidative phosphorylation, which is a process that produces ATP, our cellular energy source. Niacin also affects DNA repair epigenetically modulated gene expression. Epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. Niacin affects intracellular calcium signaling. Intracellular means located or occurring within a cell or cells according to the National Library of Medicine. So we can see how vital niacin is to health. Vitamin B3 or niacin is absorbed in the stomach and intestine. Further synthesis occurs from tryptophan amino acid with vitamin B6, riboflavin, and iron as cofactors. Although we use niacin and NAD together, as stated previously, niacin forms the active NAD element and has downstream effects on calcium intracellular storage and other enzymes that are important in cell differentiation. Meaning cell differentiation is thus a transition of a cell from one cell type to another, which plays a role in insulin response. Foods that contain the highest amounts of niacin include torula yeast, brewer yeast, rice bran, wheat bran, and peanuts. Sources of tryptophan, which you recall is the precursor to niacin, include milk, soy only consumed if non-genetically modified, now rare, and peanuts, eggs, pork, lamb, and beef. Grass-fed beef from small farms is the best choice. Niacin has been used clinically in many situations, such as rheumatoid arthritis, diabetes, and memory impairment. It has been shown to lower LDL cholesterol, lipoprotein, triglycerides, and fibrinogen levels while raising HDL levels. As little as 25 milligrams can cause flushing of the skin. Higher doses have been taken without side effects. Vitamin B5, pantothenic acid, the Greek word pantos, meaning everywhere, reflects the wide distribution of this element in nature. The biological form of pantothenic acid is coenzyme A. According to the National Library of Medicine, it has a clearly defined role as a cofactor for several oxidative and biosynthetic reactions in intermediary metabolism. Biosynthetic means the formation of chemical compounds by a living organism. Pantothenic acid occurs primarily in food as coenzyme A. Coenzyme, a form pantothenic acid during digestion. Sodium plays a role in absorption into most cells. Highest pantothenic acid food sources include beef grass-fed is best, pork, chicken or poultry that has not been fed antibiotics at the source. Non-farm raised fish, torula yeast, brewer's yeast organ meats, oatmeal, and hazelnuts. Vitamin B5 and its biological form of coenzyme AA have numerous functions, including assisting in pathways involved with the metabolism of proteins and carbohydrates. B5 affects the synthesis of several amino acids, steroid hormones, vitamin D, fatty acids, and the porphyrin ring of the red blood cells. Low levels of B5 are uncommon, but it does help with fatigue, where low energy production occurs, or reduced production of red blood cells or steroid hormones is evident. Vitamin B6, pyridoxine, is composed of 3 nitrogen-containing compounds. The active coenzyme forms are pyridoxamine 5-phosphate PMP and pyridoxal 5-phosphate PLP-SS. Passive absorption occurs in the intestine. The vitamin is transported in plasma and red blood cells, much of it regulated by the liver. Due to liver regulation of pyridoxal 5-phosphate or PLP production, possible damage from this highly reactive compound is minimal. This nutrient is involved in approximately 100 enzymatic reactions, SS. PLP is considered the active form of PLP, but is highly correlated to riboflavin status and availability. Approximately 80 to 90% of the total body pool of pyridoxine is in muscle. Vitamin B6 is involved in the effects of amino acids and participates with folic acid in the methylation of choline, serine, and methionine, which we will cover in our next video. Methylation ensures homocysteine levels, the precursor to methionine, do not increase beyond normal levels. Homocysteine's function as a blood marker in medicine for inflammation will be covered in future videos. Vitamin B6 has a role in the conversion of tryptophan to serotonin. Conversion of tryptophan to niacin is also B6 dependent. PLP plays an essential role in the production of glucose and has been shown to modulate steroid hormone activity. The highest pyridoxine food sources are plant foods, bananas, walnuts, navy beans, sunflower seeds, and wheat germ. Pyridoxal 5-phosphate is found in non-farmed salmon, beef, best grass-fed, locally sourced chicken white meat. Although B6 is essential, levels greater than 2 grams per day can induce neuropathy in specific individuals and inhibit certain enzyme reactions affecting detoxification. Food additives, such as FD and yellow number the 5th of May, interfere with B6 and certain drugs. Consider checking with your healthcare provider. B6 deficiencies can be numerous, including chelosis. Chelosis is swelling and fissuring of the lips. It is painful and results in bleeding. Glossitis is an overarching term denoting inflammation of the tongue. Fatigue, sleepiness, and stomatitis. Stomatitis is a sore or inflammation inside of the mouth. The sore can be in the cheeks, gums, inside of the lips, or on the tongue. Mood disorders, nervous system dysfunctions. The use of oral contraceptives, amphetamines, and cigarette smoking affects B6 levels. Vitamin B6 is involved in so many enzymatic reactions in the body and is vital to the production and modulation of many compounds, but the list is too long to mention here. B6 levels should always be evaluated because of its web-like effects. Vitamin B12, cobalamin, a term chemists use, refers to cyanocobalamin. In clinical nutrition and pharmacology, vitamin B12 usually includes all carbamides active in humans, such as its coenzyme activity called coenzyme B12. Vitamin B12 is synthesized by bacteria and exists in all animal foods. B12 proteolysis, which is enzymes breakdown of proteins or peptides into amino acids, occurs in the stomach. The stomach also secures intrinsic factors, or if necessary, for B12 absorption. Calcium is also needed for this process. The highest food sources of B12 are animal products such as grass-fed beef, liver, non-antibiotic-induced poultry, non-farmed fish, and pasture-raised eggs. There are numerous forms of cobalamin, and the foods mentioned contain primarily adenosylcobalamin and hydroxycobalamin. Cow's milk and cow products contain less B12, mainly in milk as hydroxycobalamin and methylcobalamin. Plants do not contain bioactive B12 unless they are contaminated by microorganisms. Vegetarians commonly attempt to obtain B12 from sea vegetables such as wakame or nori. These and their related species contain B12 analogs that do not appear as of present known to be metabolically active in humans. Vitamin B12 is used by all DNA synthesizing cells to help facilitate folic acid. B12 is critical to the hematopoietic red blood cell system. Different forms of anemia can occur with deficient B12 or intrinsic factors. B12 is crucial in the function of the nervous system. Glial cells in the brain can be affected if B12 becomes deficient. Low B12 can lead to homocysteine accumulation with neurotoxic, nervous system toxicity, as a consequence. The role of B12 in producing neurotransmitters when low can show as mood imbalances in susceptible individuals. Supplementation of B12 comes in numerous forms. Healthcare providers should check which form is needed. B12 will help manage anemia, asthma, fatigue, hepatitis, numbness and tingling, and many other conditions. The lack of intrinsic factors in the stomach's parietal cells may be the reason for inadequate B12. Vitamin B12 is extremely safe with no toxicity ever reported. Folic acid and folacinic acid or 5-methyltetrahydrofolate are supplemental forms. Folic acid is derived from its Latin name, folium, which means foliage. This is an appropriate connection since folic acid is widespread in green leafy plants. Its highest food sources are brewer's yeast, legumes, and rice germ. Diets high in animal protein, except for the liver, provide little folic acid. Folic acid is easily destroyed by cooking. Folates require specific enzyme reactions to be absorbed in the intestine's brush border area. The mucosal membrane of the intestine sequesters the folates, which are transported across the intestinal membrane. See our gut video for further information. Folic acid is essential for the methylation process of brain myelin, the coating surrounding neurons. Folate is central to all rapidly dividing cells, including blood cells, cells of the GI tract, and germinal cells. Egg and sperm cells are called germ cells, in contrast to the other body cells called somatic cells. Folic acid has been found to manage elevated homocysteine levels, which can cause vascular damage. For specific individuals with genetic traits that affect detoxification processes, folic acid can be beneficial in these individuals. Synthesis of cysteine from methionine is folate-dependent, affecting glutathione production. We will explore the importance of glutathione in future videos. Folic acid given to pregnant women is known to prevent neural tube defects ranging from spina bifida to anencephaly, a severe congenital condition in which a large part of the skull is absent, along with the cerebral hemispheres of the brain, must be given preconceptually or within the first weeks of pregnancy. Folate insufficiency has been associated with mood disorders such as depression, especially in older populations, and should be considered in these individuals. High doses of folic acid can cause some hypersensitivity in some individuals, such as irritability, GI tract problems, and insomnia, SS. Signs and symptoms of deficiency may be anemia, fatigue, shortness of breath, and pale skin. GI tract difficulties such as diarrhea or decreased appetite may suggest deficiencies. Biotin or D-biotin is a B vitamin that receives little accolades in nutrition texts. It is absorbed in the intestines, and the transport of this molecule is not completely understood, but enterocytes in the intestinal wall are involved. The mechanism of transport is impaired by chronic alcohol intake. Raw egg whites contain avidin, a glycoprotein that may affect absorption. A vegetarian diet may enhance absorption because of the effects on gut flora. Biotin is widely available in foods, but its bioavailability is highly variable. The highest food sources are brewer yeast, liver, soybean if not genetically modified, which is now rare, egg yolk, rice polish, peanuts, and walnuts. Biotin is crucial to several enzyme systems. Biotin deficiency is known to lead to the accumulation of odd-numbered fatty acids in the liver, red cells, and plasma. Biotin deficiency may also lead to the accumulation of lactic acid in the central nervous system. Classic symptoms of deficiency are characterized by alopecia, scaly dermatitis, nausea, depression, hallucinations, muscle pain, and localized paresthesia, an abnormal sensation, typically tingling or pricking, pins and needles. They also include hypotonia, meaning decreased muscle tone, seizures, and ataxia, meaning lack of coordination. People with ataxia lose muscle control in their arms and legs. This may lead to poor balance, coordination, and trouble walking. Ataxia may affect the fingers, hands, arms, legs, body, speech, and even eye movements. Biotin also supports the promotion of healthy hair and nails, which comes from the positive effects on the metabolism of oils and the creation of the active form of folic acid. B vitamin complex and biotin can help with fatty acid metabolism issues. It's important to understand that normal intestinal bacteria or microbiota mentioned in our gut health video is mainly responsible for the absorption of biotin. Biotin deficiencies are rare, especially with the consumption of egg yolk. Remember, egg whites will interfere with the absorption of biotin to an extent that is not known. Excess animal products and reduced vegetable consumption can affect biotin absorption as they may interfere with gut flora health and biotin synthesis. Biotin does have the capacity to influence insulin sensitivity and glucokinase activity. Vitamin C ascorbate has 3 forms, and ascorbic acid is the reduced form. Humans cannot synthesize vitamin C from glucose because we lack one enzyme. Thus, humans must ingest vitamin C, which can be absorbed in the intestine. Food sources are red chili peppers, green peppers, guavas, cantaloupe, broccoli, cauliflower, Brussels sprouts, grapefruit, and strawberries have the highest levels of vitamin C. Potatoes, citrus, acerola cherry, and sago palm are also food sources. Note that vitamin C is often derived from corn-based material. Most corn today is genetically modified and should be avoided. Ascorbic acids and mineral ascorbates such as sodium, calcium, magnesium, potassium, and calcium are commonly used in supplements. Vitamin C reduces several oxidizing agents in the body. It has antioxidant functions with lipids or fats. Low-density lipoproteins or LDLs are also protected from free radical damage by vitamin C. Vitamin C acts as a substrate, the substance on which an enzyme acts for 8 enzymes that affect collagen synthesis carnitine, which plays a critical role in energy production catecholamine synthesis. Catecholamines are hormones made by your adrenal glands, peptide amidation, which affects certain hormones, and tyrosine amino acid metabolism. Vitamin C helps proline form stronger collagen and soft connective tissue, repair wounds, improve gum health, and reduce bruising. Vitamin C can regenerate vitamin E through certain ion processes. Scurvy, rare in the United States, is the classic vitamin C deficiency that occurs when the body pool of C falls to about 300 mg. Fatigue is the first sign of deficiency. Bleeding gums, sublingual bleeding, impaired wound healing, joint pain, loose teeth, gingivitis, easy bruising, frequent infections, and cardiovascular disease. Vitamin C helps create immune system activities, enhance white blood cell activity, and produce immune-mediating chemicals. Stress, both emotional and environmental, can cause excretion. Greater intake may be needed to cope with a stressful environment. Vitamin C is considered extremely safe. A physician should monitor large doses. Although concerns have been raised over the ability of vitamin C to cause renal kidney stones, a review by the New York Academy of Sciences refuted this issue. A review of 20,000 patients found no cases of renal stones associated with vitamin C consumption. Vitamin E is a fat-soluble vitamin made up of 4 compounds called tocopherols: alpha, beta, gamma, and delta. 4 other vitamins, chemically similar substances with qualitatively identical vitamin activity, are known as tocotrienols. Tocotrienols are also labeled as alpha, beta, gamma, and delta. The highest food sources of vitamin E are in plant foods, especially oils of nuts and seeds. Wheat germ is an excellent source, along with green leafy vegetables. Only in the fatty portion of animal meat is vitamin E available. Cooking can substantially lower vitamin E amounts. Vitamin E supplements are sometimes made from the byproducts of vegetable oil refining. Tocotrienols are a better choice. We must subdivide the structure of vitamin E. Alpha tocopherol is considered the most bioactive. Beta tocopherol is 25, 50%, gamma 10, 35%, and alpha tocotrienol has roughly 30% bioactivity. Vitamin E is found in the diet predominantly in the alpha and gamma tocopherols. They must be acted upon by the bile acids from the liver. Absorption then can occur in the intestinal mucosa. Like dietary fat, vitamin E must be incorporated into chylomicrons, primarily hepatocyte liver cells. Chylomicrons are large triglyceride-rich lipoproteins produced in enterocytes' gut cells from dietary lipids/fats. Hepatocytes are responsible for vitamin E to be incorporated into very low-density lipoproteins VLDLs, which can then be transported to other tissues. Vitamin E protects certain fatty acids and their protective phospholipid membrane so they will not be oxidized and damaged. Those cells with high polyunsaturated content include erythrocytes, red blood cells, neurons, and lung epithelium, the thin tissue forming the outer layer of a body's surface and lining the digestive tract and other hollow structures. Phagocytes, particularly important white blood cells, also have rich stores of vitamin E. Vitamin E also protects tissue with high oxygen exposure. Vitamin E protects vitamin A and increases its storage. Please note that vitamin C and the regeneration of vitamin E to its normal antioxidant state and the ability of one antioxidant to regenerate another show the interdependence among nutrients. This is why nutrients should be given carefully and kept in balance. Deficiencies are difficult to diagnose as vitamin E's range is widespread. Since the cell membrane is susceptible to oxidative stress, nutrients that can protect cell membrane integrity are important. Insufficient vitamin E may result in DNA damage and decreased energy protection in the cell's mitochondria. Posterior spinal column abnormalities in children affecting deep tendon reflexes and impaired sensation may be a vitamin E deficiency. A qualified physician can help with proper diagnosis. Vitamin E is considered safe. Some may experience elevations in blood pressure. Patients on anticoagulants should use it cautiously and be monitored by a physician. Vitamin A is a fat-soluble nutrient identified as all-trans-retinol because the vitamin A family includes the aldehydes retinol and retinoic acid. The carotenoids beta-carotene, being very well known, are another group of nutrients in the vitamin A family. In nature, carotenoids are widespread, but less than 10% have vitamin A activity. Beta-carotene, alpha-carotene, and gamma-carotene have the highest vitamin A activity. The highest food sources of vitamin A are liver, egg yolks, non-homogenized whole milk, which does not contain hormones or antibiotics, fresh butter from the farm, and fish liver from non-farm raised fish. Carotenes are found in dark leafy vegetables and yellow and orange vegetables. This includes squash, yams, sweet potatoes, and carrots. Vitamin A primarily exists in the retinal form. Proteolysis, the breakdown of proteins into amino acids by enzymes, releases vitamin A and carotenoids from food, and is then absorbed in the intestines. Carotenoids are more dependent upon fat to be absorbed than vitamin A. Provitamin carotenoids must go through a process to be broken down for absorption, transport, and utilization. Pure vitamin A is stored primarily in the liver, and 80 to 90% is absorbed orally. The primary functions of this important vitamin are related to the health of vision, immune function, bone development, cellular differentiation, growth, and reproduction. It is also responsible for the detoxification processes of xenobiotics such as PCBs, dioxin, and many others. Vitamin A is needed in the maintenance of epithelia tissue. Epithelial tissues are widespread throughout the body. They form the covering of all body surfaces, line body cavities, and hollow organs, and are the major tissue and glands. This includes all mucous membranes, the cornea of the eye, skin, and all organs. These tissues rely on vitamin A for proper tissue turnover. This results in greater susceptibility to infection. Signs of deficiency include night blindness, poor dark adaptation, poor wound healing, and infection susceptibility. People with diabetes have a decreased ability to convert carotene to retinol. Deficient individuals include weight loss, anorexia, reduced steroid hormone synthesis, and poor tooth and bone function. Infection depletes vitamin A stores and needs to be replaced, or infection can worsen. Vitamin A can be helpful in acne and psoriasis. It is essential to know that vitamin A is a fat-soluble vitamin that can be stored, presenting a potential toxicity. Although only minor cases of toxicity have been reported worldwide each year, it must be kept in perspective. In the presence of vitamin A toxicity, such as a headache, fatigue, or emotional lability, meaning something that is constantly changing or is likely to undergo change and dry skin, then an evaluation should be done by a healthcare provider to explore if high doses of vitamin A is occurring. In the 21st century, vitamin D is a critical element of health. We will spend the time and information needed to impress upon you the importance of this element. Over the years, from 2020 until the present, there have been misinterpretations of the role of vitamin D on health and infectious diseases. We have provided numerous references for your review. The basics. Vitamin D is known as calciferol and is considered a cicosteroid. Cicosteroids are alternatively described as a subclass of steroids or derived from steroids. It was understood initially as a cure for rickets. Currently, it is understood as having more action of hormone-like activity and is not considered a true vitamin. The active form is 1,25-dihydroxycholecalciferol. It is now common for physicians to test for blood levels because of the importance of this element in health. The highest food sources of vitamin D are from liver, farm-fresh eggs, fatty non-farm fish, butter sourced locally, and unhomogenized antibiotic-free milk and dairy. Other sources are sardines and sunflower seeds. Plants are low in vitamin D. 10 minutes of sun exposure to the face and hands create production of roughly 400 international units of vitamin D. Sunlight provides vitamin D, but it must be changed to dehydrocholesterol in the skin. It is then transported to the liver, where it is converted to a prohormone calcidiol, and then to the kidneys or specific immune cells, where it is converted again into calcitriol, the active form of vitamin D. It should be noted that vitamin D2 should not be consumed in a supplement because it is more easily toxic. Make sure any supplement taken does not contain D2 on the label. Early in the 1900s, cod liver oil was the primary supplement source, which is still used today but must be adequately distilled, removing excipients such as heavy metals. Contact Hydrex and Company to see which oils are safe to consume. Presently, there is a worldwide pandemic of vitamin D deficiency. The most common adult ailment today is osteomalacia, a failure to mineralize bones properly. This is seen in latitudes where the UV light levels are low. Like a singer hitting a pitch that shatters a glass, vitamin D needs to have its B ring shattered by UV light, so vitamin D3 can be produced. This vibration must also be in the spectrum of the UVB band between 295 and 300 nanometers, which is narrow. Less intense sunlight cannot cause the formation of vitamin D3 from 7. Dehydrocholesterol. Most of the population of the US, all of Canada, and most of Europe live in low sunlight areas for several months of the year. Since vitamin D3 has an essential effect on bone structure and growth, it is a concern for children who spend many hours indoors. Older people are at risk of vitamin D3 deficiency. As age creates thinner skin, 15 minutes of sunshine equates to about a quarter as much vitamin D as young people exposed to the same amount of sunshine. Most of the world's population does not get enough sunlight to form sufficient vitamin D during winter. Vitamin D is a hormone with receptors on every cell in the body and helps regulate at least 200 genes. It plays a role in fighting infectious diseases and inflammation. According to the Academy of Pediatrics section on breastfeeding and the American Academy of Pediatrics Committee on Nutrition, although it is well known that even low amounts of vitamin D can prevent rickets, it continues to be seen in infants and children, especially those with darker skin pigmentation in the United States. Other diseases, cancer, depression, atherosclerosis, myopathy, asthma, insulin resistance, diabetic retinopathy, rheumatoid arthritis, polycystic ovary syndrome, premature birth, are just a few affecting the population due to vitamin D deficiencies. Osteomalacia, not rare in the United States, has been found to frequently be misdiagnosed as fibromyalgia or FM and has similar symptoms. Studies found that fibromyalgia patients are deficient in vitamin D, with only 30% having normal levels. These individuals are more likely to have anxiety and depression and should have their OHD levels tested. Vitamin D has been found to be a chemopreventative agent. Chemoprevention is the use of a medication, vitamin, or supplement to stop cancer from happening. Like other steroid hormones, vitamin D helps regulate numerous proteins that positively affect health. In young persons, just one 15-minute exposure to the sun in summer can give an equivalent production similar to a dose of 10,000 international units of D3. The parathyroid hormone PTH induces the enzyme that converts 25-OHD to the active hormone 1,25-OHD, activating specific intestine responses to affect calcium levels. PTH and calcium work together to balance calcium levels for normal cellular function. Another measure of vitamin D levels, especially in the elderly, is to look at muscular activity. Studies found supplementation with D decreased falls in older adults by 20%. Prevention of disease biochemical tests of cellular enzymatic function will give better data on the needs of the individual. A qualified healthcare provider can assess your D3 intake with proper measurements of blood levels, along with PTH and calcium levels. Winter months are essential for a higher dose, but check with your physician. To recap, vitamin D is a hormone. Cholecalciferol is a prohormone that the body converts to a prohormone and then to the active hormone. It is a unique, complicated process. Vitamin D and other fat-soluble vitamins A, E, and K should be taken with food, so bile acids can help absorption. Some suggestions. There must be a balance of too much sun, which causes aging of the skin and wrinkles, and can cause skin cancer. Malignant melanoma is the most deadly skin cancer. Toxins from cosmetics and even certain sunblocks are at issue. But not enough sun, as stated, can also predispose one to disease. Suggestions for safe sun exposure are in summer. Avoid the hottest time of the day, 11 a.m. to 1 p.m. is best. Wear hat to protect head, face, and neck. If sunblock is used, read the label to be assured it provides the proper coverage with very low toxicity levels. Vitamin K takes different forms. K1 is a naturally occurring form found in plants. Menaquinone K2 is a variant form synthesized by bacteria found in animal foods. Menadione K3 is the synthetic form of vitamin K. The highest food form of vitamin K1 is chlorophyll. Water and fat-soluble forms of chlorophyll-derived vitamin K are available. The fat-soluble form seems to be the most beneficial. Turnip greens, broccoli, lettuce, cabbage, spinach, liver, and beef contain vitamin K. Absorption of vitamin K depends on normal fat absorption. It is absorbed in the upper two-thirds of the small intestine and is transported to sites needed. The integrity of colonic microflora is important for all absorption needs to maintain vitamin K status. It has been estimated that the bacterial manufacture of vitamin K may account for up to 50% of K needs. Refer to our gut health video for more information. The primary function of vitamin K is in the formation of clotting factors, such as prothrombin 7, 9, and 10. Carboxylation is the chemical reaction in which carboxylic acid groups are produced by treating the substrate with carbon dioxide. This process is often used in chemistry. This allows prothrombin to form calcium-binding sites involved in blood clotting. This carboxylation process may also help form osteocalcin, which is known as a calcium-binding protein, a non-collagenous protein hormone found in bone and dentin, necessary for the mineralization of bone and dentin. Long-term vitamin K deficiency affects osteocalcin synthesis and bone formation, and may impair bone integrity and growth. Patients with secondary fractures due to osteoporosis showed low levels of vitamin K. Yet gut production of menaquinones is still not fully understood. It is uncommon and difficult to test for vitamin K because of its synthesis in the intestinal tract. Excess of vitamin A and E antagonize vitamin K. An individual's gut health should be explored if problems with fat absorption, general malabsorption, or bacterial imbalances are common today and lead a clinician to suspect decreased vitamin K stats. Vitamin K2 is now being promoted in certain circles without concern for this affecting clotting. This needs to be explored further. Vitamins play a role in most metabolic processes, the complete interactions of digestion, absorption, and health of the GI tract all play a role in how these elements will be analyzed, synthesized, and utilized by the body. Gut health, explored in our gut health video, should be a precursor to learning about the profound effects of a healthy GI tract on one's health. With the advent of the internet and inaccurate health data, Hydrex Co, with over 3 decades of healthcare and research experience, have put together this video and others for your benefit. Knowledge is power. The videos presented will give you and your family up-to-date, accurate information to make educated health decisions. We hope you will enjoy them and share them with others. References are provided. Always remember to consult your healthcare provider before using any supplementation regime. Supplements today are often compromised due to lack of oversight and must be chosen carefully. Go to our video, "Are your supplements safe?" for more information. Feel free to use our references for more details. Thank you so much for watching and listening. Our products and more content can be found at hydrexsupplements.com.